My name is Dr. Sylvestre Bazikamwe, Gynecological Oncologist. I'm from University of Burundi. I'm Burundian. First of all, I would like to thank Merck Foundation for this opportunity. I get the chance of training in gynecological oncology because Merck Foundation was launching a program in Burundi, and they give us some notebooks, and we saw that they had cancer access program and Merck Oncology Fellowship. I saw it and I was interested in cancer care, especially in the domain of gynecology. And I have applied and I get the opportunity to have this training at Tata Memorial Hospital. In my country, we don't have any oncologists. I'm the first gynecological oncologist in Burundi. We have only one resident who is training in China in medical oncology, but he has not yet finished. So in my country, in Vendome, as well as we speak about cancer problem, we have two main problems. The first one is that there is no specialist in oncology domain. For example, I can say that the cases of cancer are treated or managed by gynecologists who didn't get any training in oncology. That's a first problem. The second problem is that in my country, we have something like a stigma of population who could have cancer. So people are afraid of saying that they could have a cancer case, and this leads to the problem of they cannot go to structures that can do diagnosis. There is no structures, and also they cannot be managed, or there is no kind of early detection because population cannot know that they can survive after cancer management or thrive after cancer treatment. That's a big problem. So in my university, we have set up a small program on cervical cancer. We do some early detection, but nationally, in Burundi, there is no national program of early detection of cervical cancer, of any other kind of cancer that could be diagnosed and managed. That's the big problem. So we need to go ahead, because most of the time physicians say that someone has a symptom like a mass, and when the mass is removed, if it is a cancer, it's not a whole treatment, because even if the mass is removed, there is no medical chemotherapy, for example, and there is no radiation therapy. This training of Merck in cancer care is a milestone for my country. It's a unique opportunity to go ahead in the training of physicians. It's a good opportunity to plan how we can begin prevention, early detection, management, and follow-up of our patients. I do know that this is very, very hard to do. But for me, it's very interesting because I have already been trained. I saw mainly, basically, the surgical procedures in the domain of gynecological oncology. And the second thing will be to set up a program to do diagnosis and to treat patients in Burundi, the domain of gynecology. And also it will be a good opportunity for me, for my patient, for my country to sensitize population in cancer care. When I was coming at Tata, I had already been informed on how Tata is dealing with patient care. I knew that at Tata I will get opportunity to see many cases, and Tata is a structure which is well known. I was expecting that I have to do surgical procedures in the domain of gynecological oncology. And also, I expected to have a contact with senior who normally deal with cancer care, and to see what is the equipment, what are the procedures they do, and what are the diagnostic tests, and also how they manage cases and they do follow-up of patients. That was what I was looking for at Tata, mainly to have surgical procedure skills and competence, so that when I return to my country, I could do a surgical procedure alone, but also to have an idea of how to plan the treatment of cancer, from surgical procedure and also for chemotherapy if needed, or radiation therapy if needed, and also the outpatient care department, how patients come to Tata and what is the follow-up after treatment at Tata. So I was exposed. I know, for example, I can say in the outpatient care department, OPD, many people, because of COVID exposition, in operating room also, when they are doing the first step of patient care, induction, especially in intubation, and also in contact with patients, with colleagues, and also at cafeteria. Everywhere I was exposed, I know. But the hospital had set up some recommendation to follow so that the exposition cannot bring to the infection. That's, I can say, the hygiene condition, the port of mask, these are personal protective equipment, PPI, face shield, and also simple measure like social distancing and so on. We had to fight against contamination of COVID. I think it's very important for trainee, for example, to know what is going to do and what he is going to learn. For example, when you are learning surgery, you must to be careful so that you can be involved in skills practice, surgical procedures. This is very important, and know how many procedures you have done, how kind of procedure, and what is your need in terms of your capacities, your competencies in surgical procedure. That's also very important for the one who train, because we have what we call learning curve. Anyone must have a learning curve, especially in surgery. Learning curve is how many times have you done correctly a procedure in front of your mentor, so that he can say you are allowed to do on your own, alone, without any help. This is how many times you repeat correctly the procedure, so that the mentor can say, okay, you are allowed to do this kind of procedure because you have done it correctly when I was training you. Thank you. I think there is no other organization like Merck who is doing cancer training program in Africa. And when I was very happy to see that I was put on the list of the Merck trainees. And I think this is a good idea from the Merck Foundation, and I wish if it could continue all over the country in Africa. I would like to thank Merck Foundation for this opportunity to be trained at the Tata Hospital, and I would like to thank Tata Memorial Hospital and its consultant, chief of department, administrative personnel, and also patients, on which we have got opportunity to learn many things. Thank you for Merck Foundation, and thank you for Tata Memorial Hospital. Burundi.